you get to interact, right? Instead of
Absolutely.
yeah.
Like we are right now. They're hearing us talk. Hey, everybody.
Exactly.
Dr. Silverman here. I'm here with industry expert Ryan Smith. I can promise you in the next 45 minutes to an hour, you're going to learn a whole bunch about epigenetics. You're going to learn why you want to test, what to test for, and what supplements may help you along the way. So, Ryan, how you doing today?
Yeah. Doing well, doing well. Thanks so much for having me. It's always a pleasure, and really excited to always talk about this topic.
Absolutely. So, it's interesting. A lot of people always ask questions, and I want to start out with something. What's the difference between lifespan and health span?
Yeah. Well, so, honestly, I'm probably going to steal your words for this because I think that you put it really, really well in the last presentation I saw you give, which is, does anyone want to live to be 120 if the last 20 years of their life are spent sick and living a lifestyle that's not enjoyable? And I think that everyone answers absolutely not, right? They want to be able to live a healthy life, which enables them to be happy and active. And I think that the ability to do those things, or just the ability to not lose the function of your life, is really considered the health span, where a lifespan is obviously how long you can live without dying. And ideally, what our entire industry is hopefully doing and really pushing to the forefront is the idea that we can do both. And there's a really good way to measure both and to really quantify this in a way that hasn't been done before. And that can be done via this epigenetic methylation measurements.
Yeah, and you mentioned it, methylation. And by the way, everybody, Ryan's going to be on for a while. I got him through his busy schedule. Feel free to ask questions. We're going to post the questions. I'll answer anything if you have a question for me, but I want them all pointed at Ryan. You said methylation. You said it. All right. That rabbit hole. What is methylation? Why should we worry about it? And is it a great marker now for health and aging?
Absolutely. So before I even get into methylation, it might be good just to talk about epigenetics, right? What are they? Because I think that that's really the first question. And the way that I traditionally explain epigenetics to people are that every cell in your body has the same DNA, right? The cells in your eyes have the exact same DNA as the cells in your heart. The same as your immune cells in your blood. They all have that baseline exact same DNA, and that's not obviously new to anyone, as I know that anybody who's watched any of these police shows know that you can get DNA from just about anything. But the difference here is that what makes your heart cells any different from your skin cells? They're very, very different in how they function, but they've got the same genetic material makeup. And the idea is, what changes that, and what gives a cell its identity really, is these epigenetic expressions. And so these are what genes are turned off and what genes are turned on. And by changing what genes are turned off and on, you can really get a lot of different phenotypes, or to explain that word a little bit more, it's sort of the identity or the function of a particular cell in your body. And so that's the idea of epigenetics, is the regulation that your cell does internally of what genes are turned on and turned off. And one of the mechanisms by which that epigenetic regulation happens is called methylation. And that methylation is really what I think is one of the most exciting molecular diagnostics for the future of the healthcare industry.
Interesting. So we got a question already. I got a text. I told you, people, they follow me on Facebook, but they text me. So I'm going to pop the question up right over here. And it is a Facebook question. And it's, why do we age?
Oh, that is a complicated one. One that I'm sure you could add a lot of context to as well. I think that, generally, I think that, and I don't think I'm sort of speaking out of medical consensus or scientific consensus here, but generally there, are right around 9 hallmarks of aging, which are sort of these hallmarks which are not necessarily the cause of aging, but they are reflective of the aging process. And there are a lot of those things like telomere attrition, dysregulated nutrient sensing, a lot of loss of proteostasis, or how those peptides and proteins are made. And so there are probably a lot of different answers to that question. However, I would love to take a shot at why I think that we age, or one thing that definitely contributes to our aging, and one thing that we know. And I think that is this idea of loss of information. I always like to use the analogy of for anyone who was around in the 90s, whenever they were copying, CDs and music, right? Where if you copied that same CD over and over and over from a different, you copy a CD, then you take that copy and copy it again, you slowly start to lose music quality, right? You start to lose bunch of this data. And the same thing is really happening, I think, in our cells, where as I mentioned, whenever we're first born, our epigenetic profiles are perfect. Our skin cells are behaving just like skin cells. Our heart cells are behaving just like heart cells. But what slowly starts to happen as we age is that that epigenetic expression becomes a little bit dysregulated. So things that should be methylated, to go into a little bit more about methylation is essentially a way that your genes are inactivated. So if something is methylated, it generally is turned off. There are exceptions to that rule, but the idea is that as we age, things that should be methylated become demethylated. And so they're turned on even though they shouldn't be. And the vice versa happens too, where things that shouldn't be methylated become methylated. And so what ends up happening there is that the identity of our cells are slowly lost. And so our heart cells behave a lot less like heart cells. Our skin cells behave a lot less like skin cells. And there are mechanisms our body has to rejuvenate those cells and to help correct, but it's not perfect. And so there are definitely ways we can help encourage healthy aging or even reversing this process. But I think that one of the big hallmarks of aging is really thought of this dysregulation, which leads to identities of our cells being less than ideal. And that leads to a progressive loss of function, which is literally the definition of aging.
What a great takeaway when you think about it. David Sinclair, I mean, we've talked about it.
Yeah.
The inability to communicate because the body's all interconnected.
Absolutely.
And that is really one of the mainstream mantras of functional medicine, things that we talk about and adhere to. It's to get root cause resolution. And maybe the root cause resolution, like you said, is the body's inability to communicate. And you got the 9 hallmarks of aging. They were great. I'm going to feed you one. Cellular senescence.
Absolutely. Yeah, definitely probably one of the biggest hallmarks at this point. I mean, there's so much research going into this. And for anyone who doesn't know what senescence is, some people call them zombie cells, which, is sort of this idea that these cells are cells which are alive in our body, but they're sort of paused, that you don't want these cells to replicate. So one example is cancer, where, for instance, let's just say that some genetic mutation happens. Let's say you go get a sunburn in your skin, and it messes up your DNA. And by messing up that DNA, your cell says, I don't want to replicate. Otherwise, I'm going to perpetuate this sort of mistake in my DNA. And so that's one way that cellular senescence can happen, where essentially the cell says, something's not right. I need to pause. And as it pauses, that's when the problems start. You think that that's hopefully a healthy mechanism, and it is, because it might prevent a lot of other diseases. But over time, and as we age, these things start to accumulate. And as they accumulate, that's when you really start to lead to some of these bad health outcomes. Particularly, it causes this process, which I love the name, inflammaging, right? This process of high inflammation. Because what happens when these cells pause is it starts to secrete inflammation. And whenever that sort of reaches a threshold or starts to accumulate, you have a lot of inflammation in the body, and that leads to a bunch of different and negative health consequences.
Absolutely. Inflammation. It's funny, 94 to 97% of the people who died in hospitals in reference to COVID were pre-inflamed, which is
Absolutely.
a derivative of inflammation. Inflammation, our body's own process of helping ourselves or healing ourselves. When it goes rampant, it's like fire. Inflammation set a fire. When it goes too much, it damages everything, damages ourselves. I mean, I think we could have like a 2-hour podcast on that. So.
Definitely. And you can start to see how difficult this gets whenever you're looking at cause and effect, right? Because, things like type 2 diabetes cause inflammation, right? And they might even perpetuate things like senescence. And then that senescence process causes more inflammation, which then can make, these other processes, sort of unfairly efficient. And so it's hard to tease out cause and effect. But one thing we know is that what happens in that genetic makeup is incredibly important to how our bodies perform.
Absolutely. We got a question in. Mark Antold Varon, he has a question for you. How does sunburn mess up your DNA? It's a good one.
Yeah, definitely. So sorry, I shouldn't have just thrown that out there as a cause and effect, but sunburns are, sort of this idea that your body is super inflamed. It's reacting to this sort of toxic event, which is happening via UV radiation. And so UV radiation itself is able to actually penetrate these cells, penetrate the nucleus of your cells, and even sometimes break your DNA, which needs to then be repaired. And so, for instance, that's why you see skin cancer rates at much, much higher incidence when people get more sun exposure, because what happens is that DNA becomes a little bit less regulated. And it doesn't happen every time you go out in the sun. But if you do, if you particularly get a heavy sunburn, you're definitely causing changes to that baseline DNA.
A great answer. He's got a follow-up question. What are your three top supplements to manage chronic inflammation? Well, you know what? Let's talk about the supplements. It's fine. He asked.
Yeah.
Let's talk about a little bit of lifestyle also, and then get into the three supplements you would recommend.
Yeah, well, I think that honestly, you'd be better talking about this than me. I think that from a clinical perspective, there are a lot of things that you can do. I mean, even and things that are pretty simple, right? I mean, things like the best dietary and lifestyle conventions that everyone knows, right? Things like getting enough sleep, managing your diet, but also from a supplement perspective, there's a ton of things that you can do to manage chronic inflammation. Some of my favorites are things like omega-3s. As again, I'm talking to the expert here, so if we're going to use screen time, you're better to talk about that than me. But from a senescence standpoint, one of the things you can do is use things called senolytics, which are exactly like they sound. They're able to try and clear this burden of cells that are really doing nothing but consuming energy and putting out inflammation. And there are several things that you can use as senolytics. There are prescription things, there are over-the-counter things. Probably the most common over-the-counter product is Fisetin. Fisetin is definitely a product which is used to help control senescence and can limit that chronic inflammation. That if it's a result of senescence, inflammation can be caused by a lot of different things, and obviously knowing that underlying cause is helpful in choosing the supplement which is best to treat it.
Great takeaway. So I'm gonna agree with you in the lifestyle. Keep your carbohydrates low, exercise every day, piggyback on what you said with sleep. To unpack how many different supplements, I'll give 3. I love your omega-3 fatty acids. Nothing better than omega-3 fatty acids. They work with the innate immune system, also critical, great for cell membrane. And if we're going to talk about, if you think about it, if we're going to talk about communication, cell membrane is critical. Real simple. Vitamin D3, hormone 3. And I'm going to pitch one for you without question. For me now, because of what happens in the damage from inflammation, I'm a big proponent of a peptide. Protein is a large amino acid. Peptides are small amino acids. For me, what I found in my office, the new kid on the block, the jam, BPC 157, because a guy like my age who's breaking down every day and is not communicating, as my wife has said, improving communication, BPC 157 is a great choice.
Definitely. And, I could talk about BPC all day. For a lot of people who have seen me on these podcasts before, they see me talk a lot about these peptides. And there's really, definitely one of my favorites is that BPC, just because it's so versatile and it is so great at reducing inflammation and helping with healing processes by reducing that inflammation. Some inflammation is great for healing, but too much can get rampant. And the BPC allows sort of you to manage that inflammation for better healing outcomes. And just generally, a lot of those outcomes that are reduced whenever you reduce that inflammation. And so some people call it, the Wolverine healing peptide, if anyone's unfamiliar. The name itself, BPC, actually stands for body protection complex. A lot of times these peptides, since they're scientifically found and named in numbers, they might not be the easiest to remember from a sort of a sequence or a naming perspective. But one way to really remember that one is by thinking about body protection complex.
So, oops, there we go. We got another one. Do you recommend any special diet for a 17-year-old with ankylosing spondylitis?
My friend. Ankylosing spondylitis is difficult. Here we're talking about this immune system response, which is overregulated. And so, I would be afraid to speculate too much on medical conditions as I'm not a medical practitioner myself. But obviously there are some things that would be helpful supplements to that diet, and a couple peptides which I know are helpful. And so without putting myself in any type of liability by recommending interventions, I think that there are definitely things like that would reduce inflammation. There are peptides like the GHK-Cu, which has actually been studied in ankylosing spondylitis. It's also a great cosmetic product, which is over the counter and can be used for supplementation. So, and then obviously anything which helps with the immune system, which might be things we've already talked about, things like the omega-3s and vitamin D.
Yeah, I got one. A good friend of mine, Lauren Marks, just mentioned in reference to inflammation, SPMs, pro-resolving mediators. They allow for the resolution of inflammation. They're very specific to the adaptive immune system. They allow for what we call the homeostasis between the initiation and the resolution. It's a great shout out. Got a whole bunch of questions pointed right at you. Get ready. Here we go.
Let's do it.
So he wants to hear more about epigenetic testing. He wants you to email him. So you'll get that in the notes. And talking about the nutrient you just mentioned. So
Yeah, well, getting back to this epigenetic testing, I think that the epigenetic testing, I think we've sort of laid the baseline of these epigenetics and how it relates to aging. But the other thing is that it's a great way to measure a lot of different things, right? It can be used in disease diagnosis. It can be used, in trying to predict the best diets for ankylosing spondylitis, right? If we're able to identify epigenetic characteristics, which are very, very precise, then we can essentially create an algorithm to predict, for instance, things like disease symptomology. And then by looking at that algorithm, we can also figure out ways to change it. And it's the same with aging. And so this epigenetic testing, this epigenetic methylation testing in particular, is great for age, but that's definitely not all that it can do. And so if anyone's listening to this show, I would encourage them to just type in epigenetic methylation and then the disease that they're interested in or the condition that their family might have had an issue with, because it is interconnected with all of these parts of medicine. And as you mentioned, whenever you're considering the body as a whole, this is a really important process to mitigate and to test. And the good thing about the epigenetic aging is that it's connected to every age-related outcome. Age is the number one risk factor for all or almost most of sort of chronic diseases. And the idea is that if we can create a biological age, which is a little bit more accurate and sort of the age of your body, we can actually predict all of those age-related diseases much, much better. And actually, if we can manage that value, we can actually prevent those diseases as well. And so this idea of epigenetic age is not too off topic from a lot of the supplements and nutrition we're talking about, because that's actually how you can change this metric and how you can really affect preventative medicine.
I wanted to get you to talk about aging, but they're coming with everything. So let them have it.
How
you get triglyceride form of omega-3s versus ethyl esters, and then give a general protocol for BPC 157.
Definitely. So as you're thinking about omega-3s, the one thing to think about is bioavailability, right? Because not all supplements are created the same, right? And in particular, if you're doing some things that like triglycerides or ethyl esters, they still actually the body needs to convert them in order to actually absorb them, and so that can be a really big problem. However, so Mark, one of the things that I might sort of point out is that both of those might be a little bit outdated as it relates to omega-3s. Probably right now, the best sort of form of omega-3s is free fatty acids, which are generally complex to amino acids like lysine. And there are a couple of those out on the market, which essentially give you 5 times better bioavailability than some of those other forms. And beyond that, they're stable for up to 4 years. They can be packaged as a powder, so you don't have to worry about some of that fish oil taste that is generally sometimes a negative. And so I would say that the free fatty acids are definitely probably the biggest breakthrough in omega-3 supplementation, and I would encourage you to look for those products.
Okay.
And then and as it relates to the general protocol for BPC, there are a lot of different protocols on that. Generally, I would say that 10 micrograms per kilogram, either subcutaneously or orally, are generally the recommendation for dose. And you do that on a daily basis, you tend to get a lot of those good results. And so I would generally recommend 500 micrograms orally once daily.
I just want to speak a little bit personally, again, from the BPC 157. Yeah. Great for musculoskeletal health, great for improving the communication in the gut-to-brain axis, that bidirectional superhighway to health. Great choice. I have another one for you real quick.
Yeah, definitely. So ibutamoren, or the MK677, is not a peptide, but often linked with the peptides because it's a growth hormone secretagogue. So what that essentially does is it encourages your pituitary to release growth hormone, much like you would if, whenever you go to sleep and your hypothalamus signals your brain to release growth hormone releasing hormone, which goes to your pituitary and releases growth hormone, which then goes to your, all over your body, but particularly your liver to produce IGF-1. And so MK677 or ibutamoren is an oral product which can sort of mimic those effects. And it has some positives and negatives. For anyone who's not familiar with it, one of the biggest problems with it is it's not yet FDA approved and can be difficult to come by. However, if you're looking at it for growth hormone secretion, one of the other considerations here is that it makes you sort of ravenously hungry. One of the molecule it was based on is ghrelin. And ghrelin, as everyone knows, is this hunger hormone. And so people, in the 6-month and 3-month trials they looked at with ibutamoren, people actually gained weight. And so if you're looking to take a growth hormone secretagogue for, weight gain, then definitely a good one. But, most people are looking for growth hormone supplementation to help with aging, to help with immune function, to help with weight loss, to help with energy or skin appearances. And so there might be some better options out there, but the one advantage it does have is it is orally bioavailable.
So I think we have a question. What is the epigenetic test? What does it test for? Because we know that aging is the greatest risk factor for every disease. And I'm prefacing by saying, chronological age, but I'm more worried about my biological age.
Exactly. Chronological age is just a number, right? They say age is just a number. And that's true if you're looking at chronological age. But biological age is a little bit different because it is not just a number. It's the age of your body, and it is directly linked to a lot of these health outcomes. And so the way that these things are measured are by looking at methylation. And so the name of my company and our test is TruAge by TruDiagnostic. And in particular, what we test for are right around 900,000 locations on the genome. We look at if something is methylated, and if it is, to what degree. So we sort of get these ideas of percentages of methylation at different locations. And as we age, we can really predict where the methylation is for most individuals. And by looking at if you're above or below that methylation standpoint, and then we can get an idea of how well you're aging. And so in order to do that, we use these algorithms, which have been developed by statistical computer models to give us really, really accurate information. Whenever these biological age tests came out, they sounded a little bit sci-fi because they were used in things like forensics testing, where they were able to tell someone's age, at a crime scene. They were also used for refugees, right? If refugees come over the border with no identification, you have no idea how old they are. You don't know if they're a minor or if they're an adult. And so this was actually used and implemented in Europe to see if refugees were eligible for asylum in the country that they were sort of coming to. And so that was sort of how it began. But what they started to see is that it wasn't just a test for age. What it was sort of a test which was highly predictive of health events. So things like death, things like cardiovascular disease, things like cancer. So it was able to predict all of those with a really, really high degree of accuracy. Some of the most predictive things that have sort of come out from a medical perspective. And then really in 2018, there was this thing called GrimAge by Dr. Horvath at UCLA, which is even more sci-fi. By looking at these methylation marks, you can actually predict when someone's going to pass away or to die. And so the answer is that we're testing for methylation, but it's how we interpret and how we read that methylation which gives us the health consequences. And that's very, very powerful. And generally related to just about every disease or every condition you can imagine. And so it can test for a lot of different things. Right now, biological age and linking that to health outcomes is probably the most common, or I should say the most effective. And the reason being is that if everyone in the world were to reduce their biological age by 7 years, so if let's just say that you're 60 and you test as 53 years old, that's a great score. If everyone in the world were to do that, we would essentially cut disease in half. Morbidity would be reduced by 50%, and that's incredibly powerful. We'd save the U.S. over $3 trillion in healthcare if you reduce the aging rate by 20%. And so these things can be incredibly, incredibly powerful. But what we're testing for is that baseline methylation in your DNA.
So can you give us some more results? I know you have it, and I'm popping up with questions. Please have the questions come in. I won't let them off till the end. I just want to stay focused on this. I think chronological versus biological is great. I've always said chronological allows you to take the drink. Your biological will tell you what you did with the drink.
Exactly.
And that's why I don't drink, because I don't want to take the chance. But can you go into some of the results? Like there's an intrinsic versus extrinsic age and a couple of the dynamics that are going on inside, since we're really on the topic. And I'm a lot of questions.
Yeah, and this is one thing I want to emphasize. This is very, very new technology. Really, the first ever algorithms to read this metric were developed in 2013, and since then, we've just experienced a plethora of new information. But the algorithms which are used to read these DNA, sort of, you have the book, which is essentially your methylation on your DNA, but the glasses to read them, or essentially read that book, are these algorithms, and these algorithms can really predict everything. There are some that actually even predict stage 0 cancer, right? Liquid biopsies, cancer before you can measure it in any other way. And so as it relates to aging, there are definitely some important topics in aging which are very, very useful. One of those is this idea of intrinsic versus extrinsic aging. In intrinsic is sort of that baseline fundamental process of aging. It's that sort of that loss of information or that sort of happens as we age. However, there's also extrinsic aging, and that one's a little bit more unique and one that's definitely relevant in this time due to COVID-19, because extrinsic epigenetic age is sort of the age of your immune system. By getting an idea of how old your immune system is, you can make interventions to help prevent that. And particularly the extrinsic age is more highly correlated to premature death. So if you're really interested in longevity, that's maybe a metric you should pay more attention to. And it makes sense because we know that T cells have always been correlated to mortality risk. And so the idea of this baseline intrinsic versus extrinsic are important for two reasons. They're linked to different health outcomes. So extrinsic is more predictive of things like mortality and possibly cancer, whereas they're also linked to different interventions. So how to reduce your intrinsic age is a little bit different than the recommendations we might make to reduce your extrinsic age. And so by doing this, we always say you can't manage what you can't measure. And now we finally have a way to sort of manage, or I should say measure this aging process. And by measuring it, we're creating a lot of information on the best ways to manage it. And so that's why we're learning a lot more about supplementation. What supplementation is most likely to affect epigenetic age? What medical interventions? What lifestyle? How much sleep should you get? What diets should certain people eat for certain lifestyles? And so we're learning a lot more about this now that we have a way to quantify it. And that quantification only happened in 2013, and the first ever interventional trial was only in 2019. And so this is still a very, very new topic, one which we're learning a lot about. But if you're interested in aging well, and everyone should be, because that reduces your risk of all of these diseases, then this is a metric you should probably take.
Okay, so I got a few questions. I just wanted to get this one to close the loop.
Yeah. So TruAge tests can be ordered directly from consumers at TruDiagnostic.com. If you just search TruDiagnostic and TruAge, you can absolutely find it. However, you can also go to your healthcare practitioner and ask them about this. The healthcare practitioners are very, very helpful in this because they can maybe make some recommendations and actually view these reports with a little bit more data. And so I would highly, highly recommend doing this with a practitioner, as probably the amount of information that you'll get will be even more than we can offer direct to consumer. And the recommendations will be a little bit more specific to you based on that data. So you can do it either way. And you can also contact us on that same website to try and find a practitioner.
So here you go. Would you like a test like 23andMe, give important information about epigenetic methylation, Viome's new gut and health test? I know they're asking just for like a compare and a contrast a little bit.
Yeah, no, happy to do that because, whenever people talk or think about genetics, 23andMe and Ancestry.com are probably the two names that come to mind first. And they definitely led the way in the industry by doing this baseline genetic information. And that's very valuable. I don't want to discount genetic testing, but the genetic testing, I always use, it's probably not a great analogy, but if someone thinks of a better one, please let me know. But I like to sort of talk about it a little bit like a light bulb, right? If you're, you can look at a light bulb, take it out of the socket, look at it, see exactly how it's constructed, see how it's put together. And you can say, hey, I know that the function of this is to provide light or to not provide light, right? And you can say that's the function. But the problem is you don't know if it's turned on or off, right? If you're just looking at how it's constructed, you don't know what it's actually doing. And so epigenetics is a way to look at what's turned on and what's turned off. And so 23andMe gives you that blueprint, but it doesn't tell you what's actually happening, right? It can tell you what can happen, but we tell you what actually is happening, and we interpret that with some of these reports. And so a lot of people might say they do methylation testing, and this is probably important to go into. Is I know you've done some talks on this as well, Dr. Silverman, but this idea of the methylation process, because one of the most common genetic SNPs is MTHFR gene SNP, which can have health consequences, and is often talked about because one of the reasons it's so often talked about is because simple supplementation with something like methylfolate can really correct a lot of that genetic deficiency. And so one thing I like to draw a really stark difference in is, genetic tests which provide insight onto your methylation status or how likely or how easy it is to methylate, because that is not the same thing that we're looking at, which is the actual methylation on your DNA and what genes are turned on and off. And so that might be a little bit more confusing, but as it relates to the Viome gut and health test, I'm not as familiar. I do know that it is based on some biomarkers, but not methylation biomarkers. And so one of the reasons methylation is so exciting is its precision. And I just want to say that again, because that's one of the reasons everyone's so excited about this. Is it's one of the most precise testing methods to get really, really accurate data. And so you'll see a lot about methylation in the future, especially as it relates to cancer. And as I already mentioned, those stage 0 liquid biopsies to detect cancer before they even happen. And the reason being is it's so precise, right? That gives you an idea of just how little you can detect. A few cells DNA can actually signal that you have some cancer burden. And so you'll see a lot of information about that definitely in the next couple of years. But it gives you an idea of how accurate methylation is and why it's probably one of the most preferred biomarkers.
So we have another one, SNPs or epigenetic testing. How do we correlate and determine the significance of each, and or which is more useful in setting up a personalized diet, supplement, and lifestyle plan?
Great question. And the answer is that you don't have to correlate and determine significance because it's already been done. If you look at these research papers, they always come out with this sort of this thing called an R value, which is the correlation value, or how statistically significant it is. And so, choosing between SNPs and epigenetic testing right now, it depends on what you're looking for, right? There are some SNPs, let's just say, the BRCA gene, right, which is really, really predictive of breast cancer. Some of these things have really high significance to disease. There are some obviously genetic newborn predispositions where babies have them at birth, which are directly related to disease. And so the answer, it depends on what you're looking for. If you're looking for particularly longevity, the answer would be to definitely set up the epigenetic testing. If you're looking for just general information about risk predispositions, probably genetic testing is a little bit more developed at this time.
Great question. So it's never too late to reverse our body's aging process, or would it be more of it slowing down? So that's the question I get asked a lot.
Yeah.
Are we stopping it? Are we slowing it down? Can we really do this?
Yeah. So reversal of your age is possible. Reversal of your biological age is definitely possible. And as I mentioned, the first interventional trial came out in September of 2019, and that was called the TRIM trial, or and really we used metformin, growth hormone, and DHEA. And the reason it was so exciting is they were actually able to reverse the epigenetic age. In 1.5 years of chronological time, they were able to, on average, reduce the biological age of the body by 2.5 years, which is essentially a 1-year reversal in your biological age process. And since then, we've seen people even reverse that metric even more through a lot of other interventions. And so it absolutely is possible to reverse it, but it's also never too late to slow it, right? You want both, hopefully, right? You want to maximize both as much as possible. And for some people, the younger you get this done, the better, because what you can do is start to learn a little bit more about what is aging you in particular, right? You can start to say, hey, I was on a Mediterranean diet, or, I was doing intermittent fasting, and my biological age looks really good after, a year or 6 months. And so I'm going to keep implementing this, or I might start taking this supplement over another. And so it absolutely is possible to reverse the body's aging process, and to see that change in a clinical way.
We got another one. Is it ever too early to reverse chronic aging?
Not at all. Yeah, not at all. Right. I mean, the best way to prevent, I should say, the best way to treat disease is to prevent it, right? And it's the same with the aging process. We start accumulating these age markers the moment we're born. Actually, we view it even before we're born through our hereditary, right? How are actually things like famines, in the past, or actually can be found in our epigenetic signature. So if you had an ancestor who had been through a highly stressful time or a famine, that's actually reflected in your DNA and in your epigenetic profiling. One of the things I always like to talk about as well is that most people are familiar with this idea of imprinting, genetic imprinting with animals, where, fish, for instance, dolphins come out of the womb knowing exactly how to swim. Bees are able to identify exactly who the queen is. And all of those are mitigated via epigenetic changes. And so, it's never too early to reverse chronic aging, because there's never too early to help have the best epigenetic expression profile you can.
And without question, and again, a great example of chronological versus biological aging. So you're up for methylation versus acetylation?
Yeah, let's do it.
All right. There you go.
So that's a very good question as well. But quite frankly, acetylation is a little bit harder to measure, and so it's not, because what happens with acetylation is acetylation essentially is binding to the DNA or to the histone proteins, And acetylation, if anyone knows what that acetyl molecule looks like, it's a charged molecule. And so here we're getting into where chemistry meets physics, right? Where we know that, if anyone's seen magnets, right, that have polar charges, they repel, right? And that's the same thing that happens with acetylation. Whenever that binds the DNA, it can open up those histones. And by opening up that sort of the protein which binds our DNA, you're able to get transcription factors to that area, right? So you sort of cause this conformational change, which opens up the DNA to be used. And so acetylation is a little bit harder to measure. It's done by something called ChIP-seq, which is, a very, intense scientific process. But the answer is that both can be measured. Methylation is just a little bit easier, and generally has a lot more sites which can be measured all at once. And so methylation is probably the predominant form of measurement at this time for health diagnostics. I should also mention that mammals generally are a little bit unique in that we, as a baseline, have more methylation than almost any other type of animal species. And so our default is that we have these genes turned off. And so methylation for mammals can be a little bit more important than the acetylation process, but there are certain diseases which absolutely are highly correlated to acetylation ideas. And things like Alzheimer's, for instance, is very related to acetylation. And I should mention that the other good thing about methylation, and I don't want to get too into the weeds here, but you can actually use the data from methylation. We talked about how specific it is. You can actually use that data from methylation to predict acetylation at really high accurate degrees. And so you can actually use one measurement to predict the other. And so that one measurement can be all encompassing. And if anyone wants to know more about that, there's a great paper that was just released, a few weeks ago via St. Jude's, where they're actually looking at cancer predisposition and using something called methylation to activity, where they're actually able to use methylation values to predict acetylation. And so methylation can essentially, in some cases, be your all-in-one solution.
And again, you do test for methylation, but it's not the end-all be-all, as you've talked about a little bit before. The other question I got, somebody just texted me, telomerase. It was the jam 10 years ago. What happened?
Oh, so, I think that, there's a lot I could say there. I think that, but with that being said, you're exactly right. Biological aging has been almost defined for the last 2 decades as telomere process. And the idea sort of came from this, the idea of the Hayflick limit, which is that as our telomeres undergo replication, they get shorter and shorter and shorter. And as, once you start getting too short, you start undergoing this idea of replicative senescence, which again is the body sort of senses that your DNA isn't healthy or your cell isn't healthy, and it can sort of pause. And that is, telomeres have always been linked to mortality and to age. However, it's not highly linked. If you look at those correlation values, you get around 0.48 or 0.5 correlation values for telomere and age, whereas for epigenetic age testing, you're getting almost double that. The other big problem with telomeres is, although it might be correlated to age, it's not as predictive of outcomes. And so if you're getting a telomere test, usually the questions are, what is the significance? So what diseases am I more predisposed to? The answer is that it's harder to say. You can't really say definitively what health outcomes are linked to short telomeres. I think that's an oversimplification, but generally that's the case. And then the other thing is how do you change it? And sometimes telomere elongation can be difficult. And really there's only a few products on the market which have shown to do this in leukocyte telomeres. However, the good news is that epigenetic telomere estimation is possible. And so actually by using the same measurement that we're doing biological age with, we can also read your leukocyte telomere length. And we'll actually be doing that with the TruAge test very, very shortly. And the good news about that is it's got a higher correlation to time to death. Higher correlation, and that time to death correlation has a p-value in the -20s. I mean, it's incredibly precise. You've got better correlation to time to coronary heart disease. You've got better correlation to a lot of these different health outcomes. And so even measuring telomere length via epigenetics can be more accurate and more intuitive.
Excellent. Well, we've got somebody who actually must be reading my mind. Was my next question. What are the top supplements that you recommend to reverse aging?
Yeah, so there are. I like to usually split this conversation into 2 different categories. One is what has been validated in the clinical literature, right? Things that we can point to studies. The other is what we're seeing sort of anecdotally in our data sets. And at TruDiagnostic, we're we're lucky enough to have one of the largest private epigenetic databases in the world. We've tested over 13,000 patients, which is a huge amount of data. And one of the questions we ask is, what supplements are you taking? And whenever we do before and after measurements, we say, what supplements are you taking? And so we've been able to get some data on some of these things as well. And so some of the things that definitely play a role in the aging process and things that we've seen in the clinical literature to make a big difference are things we've already talked about, things like vitamin D supplementation. Vitamin D supplementation has been shown to reduce epigenetic age over the course of 16 weeks by around 1.8 years, especially in overweight patients. And so vitamin D is a great one. We also like being able to give your body the fuel to do what it needs to do. And so as we talk about methylation, we like to balance methylated factors versus non-methylated factors. So things like methylfolate, but also things like green tea extract, or ECGC as it's sometimes called, which can help with hypomethylation, as a lot of those flavonols can. We like things like DHEA. One of the interesting things that we've found is that stress and particularly cortisol can play a major impact on these epigenetic age measurements. Actually, in one of the original algorithms, Dr. Horvath's 2013 algorithm, 85 of the 353 spots are located at or near glucocorticoid receptor elements on the DNA. And so we know that stress in DNA has a big impact on some of those metrics. So DHEA, methylfolate, ECGC, or citrus bergamot. And then, some of the other things that we've seen in the data are things like, I would say, NAD supplementation, things like nicotinamide riboside or nicotinamide mononucleotide, which can help activate sirtuins, which can help regulate that DNA. We've also seen, I should say, things like anything which would generally help the immune system, growth hormone or growth hormone secretagogues, although not supplements, can definitely help. And so I would say that's generally a short list. Alpha ketoglutarate is probably another.
Yeah, I'm going to jump on the NAD plus because NMM makes that, and that is one of the big conversation pieces. And what I love about it, it goes with a lifestyle hack. It goes with fasting. So when you put those two together, then you're going to make your citrullines. Also, you could add resveratrol and pteristilbene, correct? And then you're going to make a full composite formula that's going to work at all the citrullines. So NMN is the new hot thing. I find that a lot of patients asking that are really standing behind that.
Yeah, absolutely. There's probably so many different health benefits. Dr. Sinclair talks about, NAD a lot in his book, and which I would highly encourage everyone reading. But NAD supplementation is definitely one of the big exciting interventions, because we know that NAD declines as we age, and that can be due to a lot of reasons, due to immune cell usage or just generally less production. But that is one way that we can definitely help mitigate that process, and we actually see that reflected in some of these DNA profiles.
Yeah, I got some info on NMN. I'm real robust on it, as we all know, because we mentioned anti-aging, health, energy, and metabolism, DNA and cell repair, good for weight control. Again, love it as a lifestyle hack. Resveratrol is funny in that we don't talk about it enough. The only time I ever hear resveratrol at a conversation is they think there's enough resveratrol in wine. Well, I did a study on that. So, you need 42 glasses to get enough in the bottle. So if you can drink all 42, Ryan and I'll give you a bottle. But there's a couple others that I really like in that. The ingredient you mentioned before, physin, I thought that was great because it also blunts the mTOR pathway. So, that mTOR pathway, by decreasing that, it's also not going to allow for a lot of cancer growth and a lot of compound growth.
And just to add a little bit more to that physin as well, for anybody who's really into this idea of senescence, you'll understand that one of the sort of the profile that these senescent cells have are called these secretory associated senescence phenotypes. And one of the interesting things about physin is it's one of the very few things, medical grade products or supplement based products, which inhibits multiple of those pathways. And so a lot of people talk about broad spectrum antibiotics, which are able to kill a lot of antibiotics. Physin is I often think about it as a broad spectrum senolytic, because it's able to hit a lot of those secretory associated senescence phenotype pathways and really have a broad level effect on senescence, which is very, very important.
If NMN is the new one that everybody's starting to learn about and talk about, physin is the one that's coming. He's unknown, per se, except the people who know him. It's that athlete in high school who, oh my God, this guy, LeBron James, he's going to be really good. And I think that's where that fits in. So we have a couple more questions because I know you're really busy. I don't want to take all your time. So Eva has a question for you.
Oh, that is a good question. I mean, you got some great questions on this one because DHEA definitely has some side effects, especially I would say more in women. And so the answer to that is going to be, I would say ask your physician, right? Unfortunately. But with that being said, the studies which have been validated, particularly for men, use 50 milligrams, which is way too high of a dose for women. We're actually probably, one of the questions we always get asked is what supplements should I do as a baseline? Just what is the baseline nutritional things that I should look at? And so as a result, I think we're going to be coming out with sort of a baseline supplementation protocol, and we're going to be using only 5 milligrams of DHEA on a daily basis. And so hopefully to avoid a lot of those side effects and just to maintain a normal baseline to mitigate the effect of cortisol. And so we're going to go with really, really low doses.
Great. So let's have a little wrap up, and then I want to ask you what's in the pipeline. So, I'm going to ask you, I'm going to give you a word, and you're going to give me a couple of sentences. Epigenetics.
So epigenetics it's hard to say a couple sentences. You'll probably see I'm long-winded on all these questions, but for epigenetics, the more algorithms we have to read that DNA, the better. And what you're going to start to see is that there are going to be numerous tests that come out in the future to really give you an idea of how you're aging, but not just how you're aging, how to mitigate symptoms of certain diseases, how knowing which drugs to take versus other drugs, with, for instance, metformin prediction. And so the idea of epigenetics is there's so much development happening. We could probably have this interview in 3 days and I'd have a much different topic than that. But right now, the way to think about epigenetics is it's a way to look at what your body is currently doing. It's a way to sort of see into your body's activities, and that can be helpful in a lot of diseases, but particularly in managing the aging process.
Genes not your destiny. We've all heard that. 10 to 30% of your outcome is genes. No excuses, everybody. There's only champions. No excuses. It's that environment. So everybody knows what Ryan's saying that leads you to the epigenetic outcome. I'm not going to hit you with methylation. You talked about chronological and biological, but how does your test differ and really give us that biological age? I was happy. I took it, and I was a lot younger. I'm the same age as my younger wife. I mean, it's been a bone of contention, but
definitely. So one of the things I should mention is no one should be scared of this metric. No, please don't be scared of knowing what your biological age is. You don't go into a doctor and worry about your C-reactive protein. Don't worry about this metric because you need a baseline. And so, as it relates to biological and chronological age, there are great summary papers out there, so you don't have to take my word for it. But generally, this is the most accurate method of testing how old you are and what that means for your health outcomes. And so this is the best way and the most accurate way to test the age of your body.
And we can change our chronological, we can change our biological age through lifestyle and supplements. And we gave a few: eat a healthy diet, more organic, get some exercise, see a functional medicine practitioner, take specific supplements that we talked about. So here's my question. For our practitioner, I'm a practitioner. How can they implement this test, and how can they talk about it with their patients to give a more clearer lens for health?
Yeah. So one of the things I would recommend is just taking a baseline, right? Because for any practitioner who's having a conversation with patients, you're improving their health. You're improving their health on a daily basis. The more you see them, probably the more you're helping. And the idea is now you can actually quantify that, right? You can say, I'm helping by reducing the risk of cancer by this much. I'm reducing the risk of development of a chronic disease by this much. And so one of the things I would say is take a baseline and then use it as the overall metric for your patients is, hey, this is an idea of how your health is, even before you get sick. And that's the reason I love it, is it makes disease and makes preventative health no longer binary. You're not healthy or sick. You can be, on a spectrum, right? And say, oh, I'm on my way to becoming sick, which is important to know so you can make those interventions we've already talked about. And so the first thing I would say for practitioners is get familiarized with this metric, because it's going to be, they actually anticipated overtaking blood testing in the next 20 to 25 years in terms of frequency because of all of the information that it'll be able to give us. So get familiarized with this metric, but use it as a baseline and a way to prove to your patients how much you're helping their health.
Excellent. So let me ask you, alternative, and this is not that this isn't a medical test, but a lot of alternatives love it. And all alternative practitioners, everybody sees your knowledge, everybody sees your passion. It's genuine and authentic, and I will validate that for you. With that being said, why did you create the test? It's always why. Alternative people did. I became a chiropractor because I have an issue.
Yeah.
Nobody becomes a brain surgeon because they had brain surgery, and they do a great job. So
Well, quite frankly, my background, my professional background before this was a lot in peptide sort of usage in a wide variety of medical contexts. But a lot of those same physicians are also focused on this idea of anti-aging. And the problem has always been, is that idea of anti-aging is oftentimes really separated from traditional medicine, and I thought that was a huge problem. They should be connected because this idea of anti-aging, it is preventative medicine, and that's really what can help everyone out is stopping cancer before you develop it, stopping diabetes before you develop it, and so it's a way to merge these two worlds where you can look at someone preventatively and actually quantify the effects of anti-aging. And so the reason I got into it actually was because I wanted to see how some of these peptides, for instance, like BPC, like some of these other things, these growth hormone secretagogues, were affecting the aging process and what that was doing to disease. Because all of a sudden, you don't have to do a 40-year placebo-controlled trial to look at how vitamin D is affecting outcomes. You can look at it instantaneously over the course of 6 to 3 months to see how this is changing your epigenetic expression, and then using those really well-validated, really precise methods to say how it's affecting your risk of cancer, cardiovascular disease. And so this is one metric to control them all, and it allows us to make the best health decisions in the moment. And prior to that, if you went to an anti-aging physician, and you ask, hey, what are your top products for anti-aging? You might get a whole different list of responses. But now we can apply the science, and we can actually apply a number to that, right? We can objectively look at these, and that, I think, will take this idea of preventive functional anti-aging medicine into the traditional medicine world and really help everyone.
I love it, because I'm going to piggyback on that, because when you think about it, in the medical field, and this is not a knock, and they have to be, they're reactive. By knowing Absolutely. Where you are, you can be preventative. First of all, nobody wants age. Everybody wants to look good. We know that, myself included. Nobody does more of that stuff in the morning. All those anti-wrinkle things and everything like that, Metro, the whole bit. But the association of aging and chronic disease really should be at the forefront. It should be at the top of the wave. It shouldn't be at the bottom of the sea. And that's why it's such a quality test, not just for the vanity, but the actual health component. And for practitioners out there, this is your evocative moment with the patient to really see where they are. By the way, I got a shout out. I got to give it to Garrett.
Thanks so much, Gary. We appreciate that. And like I said, there's probably plenty more we didn't talk about. So I would offer to Garrett the same I would offer to anyone watching, which is if you need any more information, don't hesitate to contact me or any of our team at TruDiagnostic.com.
Absolutely. We're getting a lot of great feedback. By the way, we just hit the most number of people watching, and it's just before, you have to go. So that's how it always happens.
And we'll probably be, if we can get a recording, also posting this to our social media as well for people to watch. And so, if you missed it and you're just tuning in, don't be afraid to reach out, and we're happy to provide the video.
Yeah. You made a good point. Tell them how they can get in touch with you. Tell them who you're involved with, and where they can see you, et cetera, and see us.
Yeah, definitely. So we're getting into just about every area of medicine, because this is impacting every area of medicine. And so if you have any questions about maybe the reach of this, definitely inquire on our website. You can email either me directly at ryan@trudiagnostic.com or support@trudiagnostic.com, and we'd be happy to get back to you, tell you a little bit more about the test, or even help you connect to a practitioner who's specialized in this test. As I mentioned, this is very, very new, and so there aren't a lot of people out there who are experts and can really help you the best way. And so we can help you find those people, and hopefully encourage a lot more people to get interested in this metric.
Also, Sam, if you're listening, because we've got a whole bunch of people, feel free to put your contact up if someone was interested in some of the BPC 157, the NMN, and et cetera, or just wanted a catalog. So Sam, put that right up in the comment section. We're on for another minute or two. So you're getting a lot of shout outs.
Thanks so much, Ava. I appreciate it. Yeah. And like I said, this is just the beginning. I'm sure we'll have another update podcast or webinar here in the future, and would love to keep you all as updated as possible as the science changes and grows.
Absolutely. That's a guarantee.
Yeah. Thanks so much, Mark. I appreciate it. Great questions, by the way. I appreciate everyone who submitted.
Absolutely. So how can they I asked how they can get in touch with you. You got any parting shots? What's in that pipeline? We got like 2 minutes left. What's in the pipeline?
Oh, so some great supplements, I think that we're going to come out with, which will hopefully be a great baseline for the rest of the things that you're doing to really maximize that biological aging process. But soon we'll have telomere length testing as part of this test. We'll be able to predict how much of a senescence burden you might have. So we're going to be doing a lot of these different things, and I would just say pay attention. And if there's an area of medicine you're particularly interested, let us know, and we'd be happy to see if there's data already that we can use to help you with better outcomes.
Outstanding. So listen, it's been my pleasure. I know you've got somewhere to go, something to do. You're a busy man. I know you blew everybody away because I didn't give you every shout out. It was incredible. We have to do it again. Love to have you back in a couple of months. It's always my pleasure. Ryan Smith.
All right. Thank you, everybody. I appreciate you having me, Dr. Silverman. Have a great day.
Have a great day, everybody.